little bit so I can share it. I can't hear you right now, but
What's up?
I said it's going live now. It's going to share it from Spectrum.
Man, you're like a whiz over there.
There's so much goes into it. It's crazy.
I wouldn't know what the hell I was doing.
All right, so we'll start at 5, 4, 3, 2, 1. All right, good morning, everybody. Welcome to another one of our Facebook Live chats. We have Dr. Michael O'Malley here today. A little early, but you always hear this early anyways,
Always
right?
here.
So this is all good. So one of the topics we're going to talk about today is cartilage restoration. But before we get into that, some big hockey news here back in Maine, pro hockey again. The Maine Mariners with the ECHL. You also a former ECHL player, so it's going to be pretty cool for you.
Former life.
And you're also covering the team as one of the team physicians.
I'm
and you
helping.
finally got a chance to get out there for the first time this season over the weekend. What was that like for you?
It was great. It was, for me, it was a little bit like coming back full circle because, it was when I was playing after college that I decided to kind of change career paths and go back to school and go back to med school to see those guys play. It brought back some fond memories, and man, they can skate, they can play, they're good players. I've been out of that for a little while now, so my skill set is not what it used to be, and they are good hockey. It's good hockey, but it's good for families, and it's a really good venue, and Portland's a hockey town, so it's great to have them back.
I think that was certainly on display too for the home opener. While they didn't get the win, that the place was filled with energy and stuff like that. But they did finally get a win, their first win of the season on Sunday. You were also covering that one. I don't know if there's any correlation to you covering the team and them getting wins. But what was it like to be there to see them actually win?
No, it was great. It was great to see that. They're very excited. It's always important to get that first win under their belt, especially for a team that's kind of reestablishing themselves in the community and so on and so forth. But they got a very good squad. They got some good players. So there's more W's to come for sure for them. So.
All right, cool. So let's get to our main topic here, cartilage restoration.
You sure I could talk about hockey all day?
I know, yeah, so could I. What types of injuries, or what are something you would see that maybe a patient would come in that would lead to needing something like this?
Yeah, so, first and foremost, the biologics within orthopedics is a very exciting field. And, from my perspective, it's fun, it's innovative. And this is these techniques offer these people a chance to keep the integrity of their knee or their shoulder, their hip or whatever. And there's a multitude of different injuries or scenarios that could predispose someone to having an injury to their bone and cartilage. And the techniques have been catered to those different injuries, to the different defects, and so on and so forth. So. A lot of times, the sooner the better that you can get after these types of things, so that you can, maybe even maintain their own tissue. But sometimes that's not the case, and we have different alternatives for those scenarios as well.
What is it that you're saying? Is the joints not working?
It's not so much that it's not working, but sometimes you can get more or less, for lack of a better term, it's a fracture. So you can get a big piece of bone and cartilage that either cracks off or breaks off. Maybe they're predisposed because they had predisposition to it, or it's more of a chronic setting. Maybe like a focal defect in one of their femoral condyles, which is just kind of broken down with general wear and tear. And sometimes that happens unfortunately earlier than later. Sometimes it happens to people that are, in their late 30s, early 40s, that aren't ready for, a knee replacement or something. And so, this field offers them an alternative, and offers them a solution that can provide them, long-term pain relief, and it's proven to be successful.
And what about someone suffering from arthritis, or maybe wants to get ahead of that? Is this something that comes into play?
It can be if the arthritis is focal, if it's not so much diffuse. So for those people that have, diffuse, tri-compartmental arthritis, meaning arthritis in all three compartments of the knee, it's not helpful necessarily for that kind of patient subset. It's more helpful for those patients that have regions of the knee that are affected while the other regions are relatively healthy.
So when it comes to the cartilage restoration, what techniques are there? There's a variety of them.
Variety of techniques. So first and foremost, if you have an acute injury and there's a piece that is off but salvageable and you get at early, you can fix it. You can fix it back in place, and that's the best case scenario. There's older techniques such as microfracture, which has been proven to work for the short term, but has been proven somewhat successful in some studies. And then there's other more advanced techniques such as autologous bone and cartilage transfer, where we harvest a piece of bone and cartilage from another minimal weight-bearing portion of say the knee, and we transplant it to the weight-bearing portion. For larger defects, there's allograft transplant, so where we take bone and cartilage from a cadaver knee and we place it into the defect, and that's been proven to be very successful, especially for the larger size defects where you can't harvest that much bone from their own knee. And then there's more advanced techniques such as when it's not bone and cartilage but just cartilage defects. There's ways that we can harvest people's cartilage. We essentially grow it in the lab and then we re-implant it into the knee. And these are novel techniques, and there's studies, a multitude of studies that are coming out now in the literature that are proven to show that these do very well.
And these procedures take place here, these outpatient procedures?
We do everything here. It's all outpatient, more or less all outpatient. And patients can sleep in the comfort of their own bed that night. And there's a period of protected weight bearing after these procedures where they do have to use crutches or a walker or something of that nature. But usually within just a few weeks, they're starting to bear some weight on these knees, and they're starting to see some pain relief and some good results. So.
And then physical therapy, does that come next?
Physical therapy is crucial to their care, and we have an extraordinary team of physical therapists here, not just in Portland, but Saco, Wyndham, Brunswick, that do a tremendous job. They know our preferences, especially for these cartilage patients, because there is you do have to protect them for a period of time, and they do an excellent job.
Awesome. A lot of good information there. And not only is Dr. O'Malley a great surgeon, a great writer as well. We've got a blog series coming out. We'll get the one up today for cartilage restoration. And if you missed any part of this video or have questions, we'll put that video in there as well. And you can always put those questions in the comments. We'll get them to Dr. O'Malley. There's no problem answering them.
Answer any questions. Yeah.
Awesome. Well, we enjoy your time as well this morning. And thank you for watching. And we'll see you again soon.